Hook. More than 10,000 children are born with missing limbs, fused fingers, damaged hearts, and destroyed eyes. The drug that caused it had already been flagged as dangerous. The company selling it knew. Governments knew. And for 4 years, nobody stopped it. This isn't a story about an accident. This is a story about a decision and the people who made it. Background. It is 1957. West Germany is rebuilding. The war is over, but the scars are everywhere, in the rubble, in the economy, in the faces of men who once wore different uniforms. Into this fractured world steps Chemie Grunthal, a pharmaceutical company founded by Hermann Wurz Sr., a former Nazi Party member, operating out of a converted soap factory in Stolberg. The company's first ambition is antibiotics. What they produce instead will become the most catastrophic pharmaceutical disaster in human history. Thalidomide begins its life in 1953, developed by the Swiss giant Ciba as a potential anticonvulsant. Ciba tests it. Ciba walks away. The compound shows no useful effect in animals. It is abandoned. Grunthal acquires it in 1954 and sees something different, not a cure, but a market. The post-war world is anxious. Exhausted. Sleepless. Grunthal positions thalidomide as a sedative, a tranquilizer, a gentle pill for frayed nerves and morning sickness. They name it Contergan. They call it safe. They call it virtually non-toxic. They have almost no clinical evidence to support either claim. By 1958, the drug is licensed in the United Kingdom. By 1960, it is sold under 37 different brand names across 46 countries. Doctors hand it to pregnant women. Pharmacists fill the prescriptions without question. Grunthal's sales team describes it as the drug you can give to your grandmother and your grandchild alike. That line will age catastrophically. One country holds the line. In the United States, FDA medical officer Dr. Frances Oldham Kelsey refuses to approve thalidomide. She finds the safety data incomplete. She finds the neurological side effect reports alarming. She holds her ground through enormous corporate pressure, through letters, through phone calls, through direct lobbying of her supervisors. Because of one woman's refusal to be rushed, the American market is largely spared. The rest of the world is not. Deep dive. Let's go back to the beginning of what Grunthal actually knew, and when they knew it. 1956. Grunthal begins distributing thalidomide samples to physicians before formal approval. This is standard practice in the era. What is not standard is what the company does with the feedback it receives. Doctors begin reporting peripheral neuritis, a painful, sometimes permanent nerve condition causing numbness and burning in the hands and feet. These are not rare reports. They accumulate. Grunthal receives them, logs them, and continues selling. 1959, a German physician named Ralph Voss publishes a warning about thalidomide and peripheral neuritis in a medical journal. Grunthal's response is not to investigate. Their response is to pressure the journal and attempt to suppress the publication. They write letters characterizing Voss as irresponsible. They do not pull the drug. Across the same period, something far worse is beginning to surface, but nobody connects the dots yet. In maternity wards across West Germany, the UK, Canada, and Australia, obstetricians are seeing babies unlike anything in the medical literature. Infants born with phocomelia, a condition so rare before 1959 that most practicing physicians have never encountered a single case. Phocomelia means the long bones of the limbs fail to develop. Arms end at the shoulder or elbow. Legs are fused or absent. Hands emerge directly from the torso like small flippers. Eyes are malformed. Ears are missing. Hearts are damaged. In 1959 alone, the rate of phocomelia in West Germany begins a steep, inexplicable climb. Pediatricians are baffled. Some blame radiation from atomic testing. Some blame a new virus. Some blame contaminated food. Nobody is looking at the tranquilizer sitting in the medicine cabinet. November 1961. Dr. Widukind Lenz, a Hamburg pediatrician and geneticist, makes the connection that changes everything. Lenz has been quietly interviewing the mothers of affected children. He asks detailed questions. What did you eat? What did you drink? What medications did you take? A pattern emerges with brutal clarity. Nearly every mother of a phocomelic child took thalidomide during the first trimester of pregnancy. Specifically, between days 20 and 42 of gestation, the precise window when fetal limbs, eyes, ears, and organs are forming. Lenz calculates the odds of this correlation occurring by chance. They are essentially zero. He contacts Grunthal on November 15, 1961. He tells them what he has found. He tells them the drug must be withdrawn immediately. Grunthal's internal response is not alarm. It is damage control. Company executives discuss how to manage the information. They consider their legal exposure. They do not pull the drug that day. They do not pull it the next day. They spend 11 days negotiating, deflecting, and attempting to discredit Lenz's methodology. On November 26, 1961, Lenz goes public. He presents his findings at a medical conference in Düsseldorf. The room goes silent. Within days, the story breaks in the German press. Within weeks, Grunthal is forced to withdraw Contergan from the German market. The UK follows. Other countries follow. But the withdrawal is not simultaneous. It is staggered, chaotic, and in some countries, delayed by months. In Australia, thalidomide remains available into 1962. In Canada, the withdrawal is slow and incomplete. In each country, the delay costs children their limbs. Now consider what the timing means. Lenz's research establishes that thalidomide taken on day 21 of pregnancy damages the eyes. Day 22 damages the ears and face. Day 24 damages the arms. Day 28 damages the legs. The drug's window of maximum destruction is a precise, narrow corridor of human development. Every week the drug stays on shelves after November 1961 is another week of preventable damage. And here is the detail that makes this a crime rather than a tragedy. Grunthal had internal documentation of birth defect concerns before Lenz ever called them. Court documents later reveal that company employees had received and discussed reports of congenital abnormalities in animals as early as 1959. These reports were not published. They were not shared with regulators. They were filed internally, and the drug continued to be marketed to pregnant women as safe. Francis Kelsey, meanwhile, is fighting a different battle in Washington. The William S. Merrill Company, thalidomide's American distributor, submits its approval application in September 1960. Kelsey reviews it and finds the pharmacological data thin, the safety studies inadequate, and the neurological side effect reports deeply concerning. Merrill resubmits the application 6 times. Each time, Kelsey returns it with questions. Merrill's representatives call her superiors. They describe her as an obstructionist, a bureaucrat causing unnecessary delay, a problem to be managed. Kelsey does not move. She is right about everything. In 1962, President Kennedy awards Kelsey the President's Award for Distinguished Federal Civilian Service. She is the second woman ever to receive it. The citation does not fully capture what her refusal actually prevented: an estimated 10,000 American children who were never born damaged because one person refused to be hurried. The global toll, however, is staggering. More than 10,000 children born with severe deformities. Potentially up to 20,000 embryos affected in total. Approximately 40% of affected infants die at birth or shortly after. Those who survive carry the consequences for life: prosthetic limbs, surgeries, chronic pain, discrimination, and a lifetime of navigating a world not built for them. And they carry the knowledge that it was preventable. Evidence? The criminal trial against Grunthal begins in West Germany in 1968. It is the longest and most complex pharmaceutical trial in German history. Prosecutors charge 9 Grunthal executives with negligent homicide and negligent bodily harm. The evidence presented includes internal company memos showing awareness of neurological side effects, records of suppressed adverse event reports, and documentation that animal studies suggesting developmental risks were never disclosed to regulators. The defense argues that the science of teratology, the study of how substances cause birth defects, was insufficiently developed in the late 1950s for Grunthal to have known what thalidomide would do to a developing fetus. This argument contains a grain of truth and a mountain of deflection. Yes, teratology was young. No, that does not explain why reports of peripheral neuritis were suppressed. It does not explain why animal data was withheld. It does not explain why Lenz's November 15 call was met with 11 days of corporate deliberation rather than immediate withdrawal. In 1970, after nearly 3 years of proceedings, the trial collapses. Grunthal reaches an out-of-court settlement with victims' families, contributing 100 million Deutsche Marks to a compensation fund. The charges are dropped. No Grunthal executive is ever convicted. No individual serves prison time for a disaster that destroyed tens of thousands of lives. Investigators pursuing civil liability face additional dead ends. Documents from the critical 1959 to 1961 period are incomplete. Some records appear to have been lost. Others are claimed as legally privileged. The full internal deliberations of Grunthal during the months between Lenz's warning and the public withdrawal remain partially obscure to this day. Competing theories about the extent of institutional knowledge continue to circulate among historians and legal scholars. The most conservative view holds that Grunthal was negligent but not malicious, that they genuinely did not understand the teratogenic risk until Lenz made it undeniable. The more damning interpretation, supported by the suppressed neurological reports and the 11-day delay after Lenz's call, is that the company understood it had a serious liability problem and prioritized managing that problem over protecting patients. The evidence leans heavily toward the second reading. British victims wait decades for acknowledgement. The UK Sunday Times, under Harold Evans, launches a sustained investigative campaign in the early 1970s to secure compensation for British thalidomide survivors. The campaign faces legal injunctions from Distillers Company, the UK distributor, attempting to suppress coverage on the grounds that the litigation is ongoing. The injunctions are eventually overturned. Compensation follows. But for many survivors, it arrives decades too late to change the shape of their lives. Verdict. Was this solvable then? Yes. The peripheral neuritis reports reaching Grunthal by 1959 were sufficient grounds for regulatory review and suspension of the drug's use in pregnancy. The failure was not scientific, it was structural. Regulatory frameworks in most countries placed the burden of proof on critics rather than on manufacturers. Grunthal exploited that gap deliberately and successfully for years. Would modern forensics crack it today? Modern pharmacovigilance systems, mandatory adverse event reporting, centralized databases, electronic prescription tracking would have flagged the neuritis cluster within months of market launch, not years. The teratogenic signal would have been detectable far earlier. Grunthal's internal communications, under today's discovery rules and digital forensics capabilities, would be fully recoverable. The executives who deliberated for 11 days after Lenz's call would face charges that could not be dismissed through settlement. Most plausible real scenario? Grunthal knew by 1959 that thalidomide caused serious neurological damage. They made a calculated business decision that the liability risk of withdrawal was greater than the liability risk of continued sales. They suppressed adverse event data, pressured critics, and when the teratogenic evidence became undeniable, they spent 11 days protecting their legal position before protecting children. This is not negligence. This is a corporate decision made by people who understood exactly what they were trading, other people's children for market share. No one went to prison. That is the second crime. CTA? 10,000 children. 0 convictions. If this story made you angry, that's the right response. Follow CrimeScopeAI for weekly deep dives into the crimes history tried to bury. Subscribe now, a new case drops every week.